So I'm approaching about 2 years as a practicing physical therapist. And I was thinking about this. I made a post a while back talking about, things that still surprise me as a physical therapist. And this was when I was practicing for about 6 months, but it still holds true. It still applies. And that is, I'm always very surprised when I highlight something to a patient in regards to what they do well in an assessment, and then they reply back to me and say, wow, nobody's ever told me that. Or at least they respond very, as if like it's foreign to them for somebody to explain to them that they actually do something very well within the context of movement. And it's just so interesting because you would ideally want to know what you can do very well or what your strengths are, especially because then if you better understood that, you can leverage them to your advantage, right? And that's just so valuable to keep in mind when it comes to an evaluation or an assessment of a patient dealing with pain or an injury. And if you don't keep that in mind and you just kind of go through the assessment and just focus on what they're bad at, you have bad flexibility in XYZ areas, or you're very tight in these areas, or you don't perform this movement very, very well, and you highlight all the compensations. I think it's just such an easy pitfall to get into. And I really made an effort to highlight and emphasize where somebody moves well, or at least highlighting somebody's strengths from my assessment first. Not because I'm just trying to switch it up, right? I'm not just trying to you know, be this overtly positive person. I think it's just, useful information for the patient, because more often than not, people just aren't aware of that. And they usually come in hot. They come in with like, I'm very stiff, I have bad flexibility, or I suck at squats. And I'm like, okay, cool, let's see it, And then I highlight, you actually move pretty well to there. I've actually assessed people who say they're horrible squatters, or they're horrible, I don't know, deadlifters, and then I assess them and I'm like, you actually move pretty well. Like, who told you this? And for some reason, it's like a belief they've had in their head, whether or not it's something they've explored on their own. I mean, regardless, like I tell them that they do well, and all of a sudden their minds are blown. I'm like, why is that the case? That kind of sucks. Maybe it's because it's so against their beliefs, but I think the thing that still surprises me, again, like I said earlier, as a practicing clinician, is that especially when they see somebody with, if it's a patient that has seen other providers, is that nobody's ever taken the time to explain that to them. And I try and make it a point to tell people and have people really understand their strengths, whether they knew them or not. If they did know them, really emphasize how to leverage them. But if they didn't, kind of really learn how to, again, leverage that for themselves when they are going to focus on something in their program. And that's just going to allow them to better engage or have a healthier relationship with movement in general. Because if somebody is overly fixating on that negative component of what their body can't do, they kind of lose sight of what they can do. And in the long term, that can be very limiting, and it can be very restraining or constraining to somebody's perception of options to move, options to solve a movement problem, whatever that might be. It ultimately also influences how they see their environment. If they see a gap that they have the capacity to jump over, but they have this self-limiting belief that they suck at jumping or something like that, they're not going to see that opportunity in their environment. And this is a thing in motor learning. This is a thing in perception and action theory. Like, your belief and your understanding of what your body can do influences how you see your world. And so if I'm the first person to have somebody better understand what their strengths are, great. I'm going to make sure that it's something they better understand and leave knowing more about not just what they're bad at, but again, what they're good at, and how to train that stuff and how to better leverage it for themselves. And it's just something that, again, continues to surprise me. If you're a coach, if you're a clinician, just keep that in mind. Don't just look for those negative things in your assessment. That's valuable information, don't get me wrong. Look for the positives. Figure out somebody's strengths, because that ultimately can also dictate what you prescribe, how you help somebody train or rehab an injury. And it's a consideration to keep in mind, to have somebody better engage or have a better relationship, again, with movement, and hopefully have a more positive outlook on working with a provider, whether it be a coach or a clinician.